Okay, let's go.
Step-by-step effective protocol to restore your period back naturally. If you're dealing with secondary amenorrhea, when your period is ceased, is referred to as amenorrhea. If you have been seeing your period before and all of a sudden you stop seeing it, it's referred to as secondary amenorrhea. But right from when you were growing up through your puberty years, adolescence, now you're a full-grown woman, you are still not seeing your period, is referred to as primary amenorrhea. And you need to find out the reason behind that. This video is strictly for solution, especially for those women that are dealing with secondary amenorrhea. Your period has been ceased. You are between the age of 11, 12, 13, upwards to 30 something, 40 something, or you have not officially entered menopause age. In fact, these days, women are even shifting the needle, like they are moving the what has been. That official age of, oh, when you have reached 50 years, you should stop seeing your period. That means you have entered menopause. Some women are exceeding that. So if you've not considered yourself to have reached menopause and your period is ceased, this step-by-step protocol will work for you. Because recently, around February 2024, a particular young lady lost her life because of ceased period. She was actually seeking for solution. You can imagine, at the age of 24, she has not seen her period for 3 months. It gave her concern, it got her worried, and she started seeking for solution. In the middle of trying to get a solution from a medical facility, her life was lost. Okay, it's really saddening because a lot of things were just going on in my mind. I'm like, what if I'm the parent? What will I do? How can this, a lot of things were just going on in my mind. All right. So studies have it that about 14% to 25% of women, adult women, are dealing with ceased period. And the truth is that if you're not seeing your period, there are consequences to that. You're predisposing yourself to endometrial cancer, womb cancer, cervical cancer, a lot of hormonal issues. From there, you could start dealing with endometriosis, adenomyosis, and as such, some women have not been able to get pregnant because their period has been ceased. And for the fact that your period is ceased, you're going to get worried. It's going to bother you. You're going to start looking for solution. But we want to make sure that that solution you're looking for is an effective one and is something that is not going to tamper with your life. It's not a solution you will get. In the middle of getting the solution, your life will be lost because it's saddening. Some people have not seen their period for a month, 2 months, 5 years, 2 years, and so on and so forth. And some women, since they give birth, like after their delivery, they've not been able to see their period. This video will work for you effectively well too. All right. So I'm up for solution. So I'll just go straight to the point. What you're supposed to do. Number one, if you've not seen your period for God knows how long, the first step you should do is actually to go and do what is called a pelvic inflammatory test. A pelvic inflammatory test, which you can do through high vaginal swab test. If you're a virgin, that means that your vaginal orifice is still closed. You can do low vaginal swab test or urine MCS. That way, you are able to find out, are there infection attacking you, coexisting, and really the side effect of it or the implication of it is that you are not dealing with ceased period. See, let me tell you, the rate at which people are dealing with pelvic inflammatory disease is on the high. And many people are playing it down. They are not understanding the implications of having a microorganism living in your system, a harmful microorganism for that matter, a microorganism that have the capacity to release toxins. That toxins in turn impacts your cells, your organs, your tissues, your hormones. That is where it can impact your period flow. All right, so get it sorted out. It doesn't even matter anywhere you are in the world. You can access a medical facility to actually do high vaginal swab test. And when the result is out, the next step is to treat accordingly. Find out the infection that you're dealing with, the growth rate. That is it a high growth, moderate growth, scanty growth? However, for some persons, they could be dealing with scanty growth, but their body is responding to it as if it's a heavy growth. Some persons, they could be dealing with moderate growth and their body is responding to as if it's a heavy growth too. All right. So a lot of factors, your genetics, your nutrition level, environment, all of these things actually determine how your body fights an infection. So because it's scanty does not mean you're not going to get treated. you're going to get effectively treated. Treat with the antibiotics that high vaginal swab test or the low vaginal swab test or the urine MCS is susceptible to. Okay, so you go through the sensitivity report and see the right one. In fact, that's supposed to help you choose the right one for you to actually treat with. Don't go and do self-medication. A lot of people do self-medication when it comes to antibiotics. That way you're reducing your chances of that antibiotic working for you. It means you are not going to become resistant to the actions of that antibiotic. So self-medication, it's a no, especially when you're trying to treat infection. The right antibiotic, the right dose, the right duration, you should follow it and you will see results. A lot of people, once they treat that pelvic inflammatory disease, their period will just start flowing. It will just start flowing, especially for some women that is about they've just delivered and they've stopped breastfeeding, like they weaned their baby and still their period is not out. Okay, you should get to do your high vaginal swab test. All right. Second protocol you're going to observe is by doing what I call pineapple combo therapy. That pineapple combo therapy is going to contain pineapple, is going to contain turmeric, is going to contain cloves. So you have the option of making it as a smoothie, as a smoothie, okay? That way you take it at night before you sleep. That is after you've had your dinner. Go ahead and take it. Take this consecutively for 14 days or 7 days or even for 30 days, depending on the duration of the seized period you're dealing with. For some persons that have not seen their period for 7 years, it means that you're going to put in more work to say that, yes, this works for you. All right. And another thing is that if you've treated that HVS infection, the infection that maybe is existing, you are supposed to do what is called assessment again. After like 2 weeks of completing that antibiotic, go and reassess and make sure that the infection have totally cleared from your system. Even though maybe your period got restored, still go and recheck. All right. Thirdly, there is what is called sleep. Have a good sleep hygiene. Quality sleep helps your hormones to relax. It helps the cells to repair themselves. It equally helps period to flow. You notice that sometimes you see your period while you're sleeping. Why is that? The atmosphere is so conducive and relaxed and the period will just pop out. Me as a woman, most of my period, I see them during my sleep. When I wake up and I say, oh, it looks like my period is out here. It's telling you that sleep is playing a huge role in making sure that you get your sleep. So if you're still harassed by lack of quality sleep, you don't get to sleep well, you don't have a good sleep hygiene, you're always on your phone, you're always watching one movie or the other, you're always gisting, you do work that leads you to midnight. It's time for you to actually get clear on who matters, your health, your hormones, or that thing you're doing. Okay, so prioritize your sleep. Very, very important. The next protocol will be Zobo combo. You're going to get Zobo leaves, Adam fruits, garlic. Zobo leaves, Adam fruits, garlic. You're going to make it like a combo. Boil them together. Okay, boil them together. Take in the morning a glass of it. Take it warm. Take it warm. Make sure it's warm, not cold, warm. All right. So the next protocol you're going to do is make sure you are exercising. Stay away from living a sedentary lifestyle. It's not doing your blood any good. Some persons, the viscosity of their blood is too thick. The circulation is sluggish. So get to work, get to exercise, involving jogging, skipping, even dancing. Make sure you're not one place. That way you're helping your blood vessels, because sometimes the uterine area, they need to get effective blood supply around that area to actually help the blood flow. It's a flow we're talking about here. Okay, so make sure you're not living a sedentary lifestyle. Lastly, you're going to stay away from endocrine disruptors in the name of skincare products. All those things you rub, whatever it is that you know that these things, they are affecting you, stay away from it. This is where reading your labels are important. Very, very important. Before you rub anyone you're going to rub, make sure it's as natural as possible. That way you're supporting your hormones. Because the truth is that we cannot rule out hormones, imbalanced hormones, from a seized period. It's actually one of it, okay? Then I just want to chip this in. If you're overweight, you need to lose weight. Many women that are dealing with seized period, 30% of them are dealing with massive weight gain, obesity. So you need to shed that weight. It could be suppressing your period flow. All right. So a quick recap, the step-by-step protocol of how you're going to restore your period naturally. That is, you don't want to use primo root. And the thing is that this protocol, they work for you. It's not just going to be a 1 month something. Once your period get restored, you will start seeing your period consecutively. Okay, unlike you using drug to induce, each month you don't induce, the period will not flow. All right, so number one is that you're going to sort yourself out and make sure you're not dealing with any kind of infection. You're free from infections, whether mixed growth, single growth. Make sure you sort it out. Okay. Secondly, your pineapple combo. I've said what it entails. Thirdly, you're going to take care of your sleep, prioritize your sleep. Then you're going to actually do your Zobo combo. The Zobo combo comes in the morning, while the pineapple combo comes at night, all right? Then you're going to stay away from endocrine disruptors, all right? That particular woman's story, she lost her life. Rebecca lost her life because of cyst period, 3 months cyst period, and it was on the news. How about so many other people that lost their life and they're not on the news and we're not even aware because of cyst period, or because you're looking for solution, effective solution, and alternative and lifestyle medicine still remains your best choice, especially when you're looking for deep lasting solution. You want this thing to be deep lasting. You don't want it to be flash and flash, flash and flash, okay? You want it to be deep lasting. It's really, really going to work for you. Thank you for watching.